Yeah, thank you. So I'll be quickly giving you a brief about nurture and what is it all about. And just a moment, just- I hope my screen is visible. Ma'am, is it visible?
It's visible.
Thank you, ma'am. So, Nurture Counseling is a dedicated mental health organization committed to providing compassionate and professional support to individuals seeking improved emotional well being and mental health. It is founded on the principles of empathy, understanding, empowerment. Nurture Counseling offers a range of comprehensive services to address various mental health challenges. We have done 20 plus certificate training programs till now, 15 plus webinars and workshops, and trained 1,000 plus psychology students across India and abroad. This is our sixth CBT batch. We are MSME registered, Startup India registered, GST registered, affiliated with APA, and accredited by the International Associations of Therapists. A warm welcome to Pratma ma'am. She is an RCI registered clinical psychologist, senior school counselor in Army Public School, Bengdubi. She is a senior clinical psychologist in nurture counseling. She holds the MSc in psychology and M.Phil in clinical psychology. She's a certified mindfulness coach, CBT practitioner, and third wave evidence based therapy. She has a 6 year experience in mental health and in mental health profession and 5 plus years of experience in clinical field. Her interest areas being depression, GAD, personality disorders, OCD, neurodevelopment disorders, mind-body therapies, and qualitative research. Thank you so much, ma'am, for joining us for the CBT batch today and for this month. Our founder, Mr. Priyesh Kumar, he has an academic background from IIM in leadership and strategy and has a 10 years of experience across multiple industries. He found Nurture Counseling in 2022 with a simple yet powerful mission to support individuals navigating challenges in relationships, career, self-care, family, aging, and corporate life. Nurture counseling has a clear aim to make therapy and mental health support a part of everyday life, especially in India's tier 2 and tier 3 cities, to reduce the stigma around mental health and to provide accessible and compassionate care for those experiencing stress, anxiety, or emotional difficulties. We offer individual therapy and counseling services, engagement programs, mental health workshops, and pre-community events. We also psycho-educate regarding various topics on our Instagram page. We provide flexible and remote therapy, regional language support, progress monitoring, and we are 100% confidential. Um, we also provide post-session reports, free library resources, as well as community support. And we are here to listen. Why? Because you matter. Nurture Counseling is India's first multilingual therapy platform where we provide therapy in various regional languages. Our mission is only to promote mental wellness, break the stigma around mental health, and empower individuals to live fulfilling and balanced lives. We do this by providing accessible, compassionate, and evidence based counseling and therapy services tailored to diverse needs. Our services include counseling and therapy, psychoeducation, online support, and community engagement. Um, as you know, my name is Akanksha and I'm a second year psychology major at Daulat Ram College, Delhi University, and I'm the social media manager. Shubhi Jain, she is a second year psychology major from Mithibai College. She's social media and marketing manager at Nurture Counseling. Our team includes Shivangi, Tanya, Shivalika, Dhia, and Tanya. Nurture counseling has positively impacted countless lives by providing a safe space for individuals to express themselves, heal, and grow. Just another information that we will be providing you with an e-certificate for this CBT training program. However, if you would like to get a hard copy certificate, then an additional fee of rupees 200 is applicable, and you may let us know on the group itself and pay the amount, and then you can get it in hard copy format. In addition to that, Nurture Counseling also promotes free student counseling, where we offer free therapy session only to the CBT participants of age group between 18 to 24. So we'll be sharing the link for the therapy session, and if you are between the age group of 18 to 24, you may fill the form and feel free to select a date between August and October within 9 a.m. to 9 p.m. time slot. For further updates, you may also connect with us on Instagram or LinkedIn, where we update very frequently regarding the programs that we are offering, and also for the internship and other opportunities. Thank you so much, ma'am. You may take from here.
Thank you so much, Akanksha, for the introduction. And as I can see that 16 of you here, I would like to have a brief introduction with you, as Akanksha already introduced me to you. I would like to have an introduction with whoever is present here. In my screen, I can see Vedika first. So can you just introduce yourself, what you're currently doing, and from where you currently belong, and also what are you looking for as you participate here in the CBT experiential course? Yes, Vedika, take the lead and start.
Hi, my name is Vedika, and I'm currently doing my bachelor's in applied psychology from Delhi University itself. And I'm based in Delhi, and I took this course to gain some insights into what CBT is actually and how does it work.
Right. Thank you, Vedika. Shahili Viswash, I can see next. Yes, Shahili. Can you just check the microphone?
Hello, am I
Yes,
audible?
now you're audible. Now you're audible.
Yes. I am Shohili Bishash. I am from West Bengal, and I have completed my bachelor's in audiology and speech language pathology. And currently, I am doing my master's in speech language pathology from AYJ Kolkata. Nowadays, I am dealing with such patients like dementia, or I am dealing with neuro rehabilitation cases. But I have very less knowledge about CBT. So I think I want to know more about the cognitive behavior therapy, how it will helpful for my in speech therapy, and how it will be helpful for my cases.
Okay, wonderful. A bit different background you belong from. So, as a rehabilitation, professional, you're also going to be another rehabilitation professional as a speech therapist, speech pathologist, rather. No? So, yes, it's important to take care of the psychological needs of your client. Though I would definitely suggest to transfer any, severe cases which related mental health attention, always transfer this to psychologist, or if severe, then to a clinical psychologist. But of course, let us see what we can do. And nice, that would be a collaborative approach for you.
Thank you.
You're mainly working with neurodegenerative clients, no? I mean, all this. Okay, thank you, Shahil. Next, I can see Crystal Polanur. Yes, if you may introduce yourself, please. Your voice is not audible. You're not audible, Crystal. Okay. Okay, maybe coming back to you. Shruti, Shruti Iyer, if you
Oh,
may kindly introduce.
am I audible? Can you all hear
Yes,
me?
audible.
Yes. So I'm Shruti. I belong to Chennai currently. I have a very huge history of traveling from city to city. And I've recently finished my bachelor's in psychology. And I've just enrolled for my master's in counseling psychology. And this is like a time that's going on for me where I'm just doing more courses on therapy techniques and trying to dive deeper into the techniques that I resonate with and I find intrigued by. And CBT is definitely one of them. So yeah, I've also just I'm almost completing another course with nurture counseling. I'm doing ACT therapy,
Hmm.
and I'm really excited to do another course. I really find the community very happy and productive. So I'm very happy to be part of the community and now this class as well.
Great. Nice to hear you, Shruti.
Thank you.
Um, Amruta. Yes, Amruta, if you may kindly introduce yourself. Okay. Okay, we'll be coming back to Amruta later. Dia.
Hi, hello everybody. I am Dia. I'm also currently based in Delhi only, and I'm doing my bachelor's in psychology from Delhi University only. I wanted to attend this session because I, of course, wanted to know more about CBT. I don't think we have learned much about it, much depth into it, so I want to explore it a little more.
You're in your graduation, no? You said?
Yeah,
Bachelor's?
doing my bachelor's, yes.
Right, right. Okay. Thank you, Dia. Okay. Now Ashmita. Yes, Ashmita.
Yeah, hi, good evening, everyone. I'm Ashmita Singh Gupta. I have recently completed my undergraduation in economics honors from Christ University, Bangalore. But throughout the course of my undergraduation, I realized that I am more passionate about psychology, so I've decided to switch to that. And now I'm preparing for my master's in counseling psychology. So I thought this workshop would be a great way for me to learn something new, given I've heard about CBT and other kinds of therapeutic methods and techniques so much. It'd be nice to actually get a deep dive into what it is and how it works. Excited to learn more. Thank you.
Okay. So Ashmita, you will be moving your career towards psychology now. You're thinking that.
Yeah.
Okay. Thank you. Yes, Shreya. Somehow Shreya's face is familiar to me. Do we
No,
know each other? I mean, have I seen you somewhere?
I
Okay.
did the June training program with
Okay,
you
okay,
and
okay.
Shubha
Right,
ma'am.
right.
Yeah. So hello everyone. I am currently doing my bachelor's in psychology honors from Rajasthan University, and right now I'm in my second year, and I have cognitive behavioral therapies are almost applicable to all the clinical disorders. So I have always been fascinated about it and want to learn it from you.
Yes, yes. Yes, Shreya. That's wonderful. No, it's very nice always to know that what in all the states it's going on. One is in Rajasthan, one is in Delhi. So it's very nice, to connect. Santosh, if you're here, then kindly introduce yourself.
Hi, I'm basically from Bangalore, and I have a. I used to work earlier as a software engineer, and I like to have a career in psychology in future. I'm keeping myself with the tools of psychology.
Okay. Okay. So you're looking forward to switch your career towards psychology, Santosh?
Yes.
Okay. Okay. Thank you. Tanya, if you may kindly introduce yourself. Yeah, such Deva. Yes. Okay. Okay. I think Tanya is having a network issue. Mansi, you may continue. You may kindly continue to introduce yourself.
Hello everyone, my name is Mansi and I recently got done with my graduation in Liberal Arts Honours with Psychology major from Chandigarh University. And I belong to Udaipur, Rajasthan, and currently I am in a phase where I am transitioning from undergraduation to post-graduation. So I just thought, why not explore the psychotherapies beyond the books and copies? So I just started with the basics CBT just to explore and then further.
Right. Wonderful. Okay. Uh, Shreya, Shreya Sharma. Okay. Mm, okay. Okay, fine. I think if anyone is left, then you can introduce yourself. My screen, whatever I'm seeing, that almost everyone have introduced themselves. Later, of course, we will keep interacting. Now, I will like to share my PPT. Mm. I hope my PPT is visible. You all?
Yes, ma'am.
Right. Okay. So as we are here, all of us in the CBT Day 1, and it will be your experiential training because whatever we'll do, we'll be trying to do in a practical manner where you can execute it in some. Mm, yes. Sorry, everyone. I got disconnected. Now my
Ma'am, please start recording again. I think you have stopped
no, I
recording.
think it is going on, but let me check. No, it's going
Okay,
on.
okay. Thank you.
Yes. So now my PPT is visible, right?
Yes, ma'am.
Okay. So at any time, if I get disconnected or the PPT is not visible, kindly let me know. Do not message. Just unmute yourself and say, as my focus will be in PPT, I'll be unable to see you all. Okay. So today, what we will be covering, I'm coming back to later, but let me first tell you that what we are going to cover in this 1 month program. So the first module will be based on CBT, history and beyond. We'll be trying to understand the fundamental. After that, we'll be focusing in cognitive strategies, and then the behavioral strategies. As your understanding knows, it's CBT, cognitive behavior therapy. So cognitive strategies followed by behavioral strategies, and last approach will be 4. We'll be learning about the treatment plan and of it. Okay. So now today, what we'll be covering, of course, module 1, and in this cognitive behavior therapy, where we will be learning the fundamentals of CBT, where does it come from? So there, what we will learn is I have jotted down here: emergence of cognitive, research supports effectiveness of treatment modalities in adult with depression and anxiety, principles of CBT, different forms of CBT, uses of CBT, importance of therapeutic relationship. I will end today's session with sample CBT model and how to make, a CBT model. So let us first start that how cognitive psychology emerged. So this cognitive psychology emerged by Edward Tolman. If you remember your graduation or whoever is studying in masters, you have studied Tolman regarding cognitive maps. Just after the behaviorism, came with the theory that how cognitive maps involves that the cognitive spectrum of the behavior. And it's not only behavior, but cognition as well. So he is the pioneer of modern cognitive. Now, in the 1950s, in the early 1950s, there is a movement called cognitive revolution. So we know that first psychoanalytic come Freudian approach, then from psychoanalytics, psychodynamic came, and then after that, behaviorism come into picture. We know classical conditioning, operant conditioning, theories of learning. So from behavior therapy branches emerged. After just the behavior therapy, in 1950s, there was a cognitive revolution that a human action is not only based on their behavioral observation, but it has a cognitive phenomena too. Originally constructed by the research, explain the psychological process and the cognitive process behind depression. He basically described CBT regarding depression only. Later, with Aaron Beck, Albert Ellis also joined, and they shared the view that most of the psychological disorders can be treated with cognitive behavior therapy. Why? Because most of the psychological disturbances or disorders arise from faulty cognition or faulty cognitive processing. I would say almost every disorder, if you see, it started from either it has started from some cognitive faulty cognition or faulty cognitive processing, or later it developed this cognitive uh, processing difficulties. So this way our CBT came into our psychology field. Now, what about the research supports? Let us first study about the research support. Let us first know about this. That CBT is one of the most strongest evidence-based of all psychotherapies. If you now look in the, as I myself is a mind-body practitioner, mindfulness-based certified practitioner, I do prefer to use an eclectic approach mainly, whatever is required with whichever client. But mainly my focus is with this two, that mindfulness based and cognitive behavioral therapy. But if you see the third wave therapy, I mean the mindfulness based therapy, then also the foundation, there is a foundation of CBT. So CBT is the most evidence based psychotherapies and can be used in all kinds of disorders. It is a vast majority of research also make it empirically, evidence based. The implementation of CBT actually started from the treatment of anxiety and depression mainly, but later it spread with all the disorders. Now there are many randomized controlled trials which have shown CBT to be more effective or equivalent to medication for management. So along with medication, if you can give CBT, it will be giving a better outcome. Later, I'll be showing a graph where you will be seeing that. So recent study of CBT with a 1-year follow-up on patients with depression were less likely to relapse than patients taking antidepressants alone. So we know that in depression, like moderate to severe depression, generally psychiatrists suggest to take antidepressants, and it's required because there is a chemical locha. There is a chemical imbalance in the brain. So of course, medication is required in case of moderate to severe depression, or in case of anxiety also. SSRI groups medications are required. But what about the faulty thoughts? What about the cognitive distortions? How to do it by medication? It's not possible. Because in case of neurology or psychiatry, in case of our brain, there are two spectrum, no? One is structural, one is functional. So yes, neurotransmitter imbalance can be solved, can be addressed with medication, but what about the functionality of our brain? That cannot be resolved. So in order to resolve that, we need therapies. Okay, so in case anyone tell you, I remember in my early graduation days and master days, while um, them early, so where people used to say that astrology and the psychology are same. Okay, and somewhere very very funny remarks, like where you will be feeling certainly, you might get angry as a psychology fraternity, or from the background of psychology, that they often say that therapy doesn't work, it is just a myth. We know there are stereotypes and stigmas around the society. So there you can reply like that our brain has two things, no? One is functional and one is structural. So the functionalities need to be resolved by therapies, irrespective of whichever therapy module you choose that you're inclined into. So in case of CBT, as we are seeing that generally with the antidepressants, in case of depression also, we have seen that if we are giving therapy, it will work better. The outcome will be better. And it has a higher response rate, like 7 out of 11 studies do show that CBT works wonder. Now let me show you this graph of, it's a very recent graph, not very old, of 2020 only. So adults with depression and anxiety. So this study has been done, it got spread in three types of three groups. One with CBT alone, one is with medication, and one with just CBT as well as medication was combined. And you can see the result that while the medication alone and CBT alone is working just the same, 50 to 75%, it is working. Now, in case of in case of the other things like CBT, if we combine CBT and medication, then the success rate, the recovery rate, the prognosis rate get increased by 75 to 90%. And that's a huge. And here I have not mentioned, but there is a decreased in relapse rate as well if you give therapy along with medication. Now coming to the principle of CBT. So we first need to know the principle of CBT. Mainly there are 10 principles of CBT. Before learning CBT, you should be very clear about the principles of CBT. So now if we see that principle number 1 is CBT is based on the formulation of patient's problem and an individual conceptualization of each patient in cognitive terms. As I told you, while I was sharing that what is our study goal today, what is our goal today, what we will learn. So there also I have mentioned that we are going to learn about the sample, about one sample cognitive model, where we can use where we can individualized each cases, that how each cases differing from one another. And it should never be like whichever therapy you are using, it should be customized and it should be personalized according to your client's need and their situation in life, what they're looking for. You should be making goals according to that. So based on that, you need to understand the first principle is the patient's problem it should be individually conceptualized in the cognitive terms. Now, coming to principle number 2, CBT requires sound therapeutic alliance. Now, how you can make a good therapeutic alliance, that I'll be telling you later, just in some next slides. But a sound therapeutic alliance is required. Of course, that is in any kind of therapy, but especially in psychodynamic and CBT, what happens that we talk very sensitive thing regarding, very sensitive thought patterns, where you will be going to somewhat history. So there, actually, you should be having that comfort zone. Your patient should be feeling safe with you in order to saying things. And the therapeutic alliance is required, that you both are working as an ally. Okay? Because I personally have used CBT in case of patients with schizophrenia, and it wonderfully works along with medication. So for that, the patient with paranoid schizophrenia, they are having doubts. Like, I have used CBT, and if the patient is not feeling safe with you, then no CBT and no other therapy will work. So therapeutic alliances, that's why first and foremost. Now, principle number 3 is CBT emphasizes collaboration and active participation. It is no way one-way method. Apart from giving you theories, I would like to engage you in activities, even in this CBT training, because CBT is never a one-way thing. It is not, it is client centric. It is never, therapist centric, that the therapist will only work. Homeworks will be there for your clients. There will be collaboration and there will be participation. Even in case of while you will be making models of CBT, what I will be describing you at the very last of today's class. Then also you should be taking help from your client, that what actually they want to include. You should be knowing. So you both should be working collaboratively, your client and you. Now, principle number 4 is CBT is goal oriented and problem focused. It is, this is actually this principle number 4. You can see that this component of CBT, or this principle of CBT, is making the difference with psychoanalytic. Because psychoanalytic is never goal oriented. It is always going into past. And it is going into past. It works on dream and all those unresolved issues. Rather, on the other hand, and by contrast, I would say CBT is goal oriented. You always will be having set of goals for your clients, and it will be problem focused. One by one, you will be focusing your problem. You will be having a short term goal and long term goal, and on the basis of that, you will be working with your client. Now, principle number 5, CBT initially emphasizes the present. Why it is initially? Because while you will be talking about thoughts or beliefs of your clients particularly, then you have to go to the past. That from where it is actually generated, from where it came. It has a past. But yes, initially you will be starting with the present, but later you can go to the past as well. It's from where this, suppose a person is having a failure thought continuously, that I'm a failure. It coming to their mind involuntarily. But from where it is coming, that you need to check back. So after the initial period, of course, you will be focusing on the present. But later you need to go back to the past. Now coming to the next principles. Principle number 6 is CBT is educative. It is the aim of CBT is to teach patient to be their own therapist and emphasizes relapse prevention. So what it means that it's re-educative is there are some therapies which are supportive. You might heard of supportive therapies. Even sometimes adjunct therapies are also there, like art, music, dance. So this kind of things are adjunct therapies because still they are not evidence-based. And slowly, empirically researches are going on. It will maybe, soon. But Apart from that, there are some therapies, typically, rather than supportive therapy, there are re-educative therapy and reconstructive therapy. So in case of reconstructive therapy, is my network poor? Are you having difficulty to hear me?
No, ma'am, you're audible.
Okay. Okay. So, where were I? Is that there are some therapies which are reconstructive. So, reconstructive therapies are like psychodynamic therapy, psychoanalytic therapy, where the whole psyche is getting reconstructed. Now, CBT is a re-educative therapy. You are changing the perception of your client. You are changing the thoughts of your clients. So that is re-education. So in that perspective, it is re-educative. Now, making your patient to their own therapist, because we are doing relapse prevention at the last. Because uh, therapy has a structure. Later while I'll be sharing with you that, in later classes, while we'll be moving to the other modules and everything, we'll be understanding that CBT is not like mm, that it will be going beyond years and years, 2 to 5 years, just like if you know that psychoanalytic goes up to 5 years to 7 years. It is not like that. So in that case, you have to make your client their own therapist per se. You will be providing the tool, you will be providing the guidance with what they can be support themselves. They can have a relapse prevention strategies with them, and of course they will be coming to follow up. Okay, so this is the 6th number principle. Now coming to 7th number principle, that is CBT aims to be time limited. What I already covered in the last point, right? That CBT is time limited. Even sometimes it happened with me that one client came from abroad and they just were seeking therapy offline, particularly, and that also needs to be completed within 3 months. So in that case, CBT can be precise and in an organized manner. It can be given. Okay, so CBT is time limited and it has a particular structure. Now, principle number 8, CBT sessions are structured. It has 3 parts: introductory part, middle part, and a final part. How it is coming later, I'll be saying that what will be there in introductory part, middle part, and final part. Generally, in final part, the part of homework. In the middle part, you will be working through the goals, and introductory part, you will be seeing the homework of the last day, and then you will be setting the goals for that particular session. Later, I'll be describe it in a far, detailed manner. Principle number 9 is CBT teaches patients to identify, evaluate, and respond to their dysfunctional thoughts and beliefs. So, our focus in thoughts and beliefs, and they first one needs to identify that what are their negative thoughts, and then they have to evaluate. Okay, I do identify that these are my negative thoughts. These are not the real thing. These are just my negative thoughts. Now they also have to evaluate that what kind of negative thoughts these are, and then how to respond to those dysfunctional thoughts. That's also you will be teaching your client. And the final principle, what you need to know is CBT uses a variety of techniques to change thinking, mood, and behavior. It comes with many tools and many things. So it has many sorts of techniques, and you are always understanding that CBT is coming with sets of behavioral uh, therapy as well, right? So it's just combining behavior therapy with cognitive therapy. Okay? So it is not just cognitive therapy, it is cognitive therapy along with behavior therapy. Now, different forms of CBT, I would just like to describe it a bit. That cognitive therapy purely also sometime it can be done, that only not you will I'll be giving you the cognitive strategies, right? We'll be learning cognitive strategies in next classes. So just cognitive strategies also sometimes you can apply, not by using behavioral strategies, just the cognitive strategies. Suppose one of the person came just with some negative purview of life, and they are not having much time in their hand. So in those cases, you can use just cognitive therapy. Behavior therapy, particularly only the behavioral therapy, and can be used with children. And in some cases, in some other cases also, while changing of certain behavioral issues is required, there also you can just use behavioral strategies. Now, the parts of learning CBT course, parts of learning doing our experiential CBT course is where you will be learning both the behavioral therapy as well as cognitive therapy. So it's a club of cognitive behavior therapy. So you are going to learn about behavioral strategies as well. And then you can customize that my client requires what now. I believe that end of the whole program, everyone will be able to identify at least up to 80% that, which things I have to give, behavior therapy, cognitive therapy, which tools. Now coming to rational emotive behavior therapy, it is by Albert Ellis. As you know that Albert Ellis was also another pioneer of and a very significant person of cognitive therapy. So rational emotive behavior therapies is mostly all the strategies of CBT only has been followed in RABT. But the stance is different. The stance is a bit direct, and it's not with, I would say, it's a less client-centric RABT, and it's more a direct approach. Of course, there are empathy, but it's more directive as well. And so in a country like India, as a clinical psychologist, I personally believe that using CBT is better than RABT. Because if you become a directive person towards your client, it's really difficult now. Now, yes, in some countries it will work. I'm not saying that it will not work at all. But yes, the stance of RABT is too much directive and direct. Okay. So the next thing is problem solving therapy, where there are some tools of problem solving of in cognitive behavior therapy only. So just picking up those problem solving skills, you can in a group setting or in a corporate setting or with the individual, you can do problem solving therapy, especially in case of suppose a person is coming with certain problem, like relationship issues, academic issues, or some other issues, maybe after major life incidents. So if they come, so they actually this problem solving techniques can be used. Now the next thing is exposure therapy, where exposure and exposure prevention therapy is a part of CBT only, which is particularly for OCD, and it is a completely different kind of CBT. That we are not going to cover, because this is particularly for OCD clients. And exposure prevention therapy, of course, most of the CBT techniques only has been used, but it's a bit different. That how it should be used, and there are particularly, it's framed according to OCD for OCD clients. Now the next thing is third wave CBT, which I started also just when I started today's class. I was telling you that even in case of mindfulness based therapies, the fundamentals, the basics are there, CBT. The cognitive restructuring and everything will be there in MBCT. You know that mindfulness based cognitive therapy. So it is CBT only. Just mindfulness component has been added with that, as it's a mindfulness based therapies. Apart from that, there is multimodal therapy, which is that different modes of therapies is being used. Suppose you are using both behavioral strategies as well as cognitive strategies with your clients. So in those cases, or maybe some mindfulness strategies as well, or maybe some supportive approaches like art or music or whichever. So in this case, it would be a multimodal therapy. So in this case also, CBT can be used. CBT can be, clubbed with other therapies. Multimodal therapy means that CBT can be clubbed with any other therapy. Now coming to where CBT can be used. So CBT, typically we think that CBT can be used with mental disorders. No, it's not. CBT can be used in mental health concerns, in physical health concerns, and in lifestyle issues. Now coming to mental health concerns, all sorts of disorders: anxiety, mood disorders, schizophrenia, eating disorders, PTSD, addictions, and whatnot. So, in all the across the length and breadth of disorders, mental health disorders, mental illness, CBT can be used. And mostly, if it is moderate to severe, it's better not to handle. Transfer the cases to clinical psychologist, I would say. Now, coming to physical health concerns. Here, many of the CBT strategies are very, very useful, like coping with chemotherapy. Just try to think a person with this kind of terminal illness, what they will not be having negative thoughts. They will be having involuntarily negative thoughts, right? Because their life gets upside down. They are going through chemotherapy. It's a major life change. So there also CBT works wonderfully. And if you know psycho-oncology, then there also many of the strategies in psycho-oncology is been clubbed with CBT, strategies of CBT. So CBT can be used in chemotherapy, patients with cancer. In chronic pain, CBT is useful because psychopathic pain and some pain, related with psychological trauma, and these things are common. So in those cases also, in chronic pain also, CBT can be used. Just in any case, any terminal illness, any kind of new diagnosis, CBT can be useful. Maybe a person has been just recently diagnosed with that they need to have dialysis regularly. Think about their sudden change of the whole psyche and the scenario, the situations, their thoughts, perception of life. There also CBT works. Chronic fatigue, maybe due to thyroid, maybe due to other things like HIV and other STDs, or many kind of diseases are there. In those kind of diseases, the chronic fatigue seem to be present. So in those kinds of diseases, you can use CBT. And also insomnia. Maybe typically insomnia, you're not finding any psychological background or reasons, but they are having sleeping problems or insomnia. So in that case, also CBT is very useful in case of insomnia. Now coming to lifestyle issues, this kind of cases, after you practice by yourself and after your masters, of course, you can use CBT in lifestyle issues. Okay, like someone is having assertiveness issues, difficulty in saying no. Maybe someone wants to start diet, but they are having a hard time. They are not getting the internal motivation to start dieting, maybe due to some other medical conditions. They need to start healthy lifestyle. Maybe they are having some lifestyle disorders. Even you can include PCOS or PCOD or any other kind of disorder, diabetes type 2, where their major, food habits needs to be changed. So, and exercise and the whole lifestyle needs to be changed. So in those kind of thing, also CBT can be useful. In case of social isolation, maybe, they change a social situation, frequent changes in social situation, or maybe in any transition period, like school to college, from one school to another. So this kind of cases also can be helped with CBT. Grief, in case of major grief, loss of loved one, or job loss, or divorce. In this kind of cases also, CBT can be used. Major life challenges and major life changes, I would say. And in case of anger management, a person having pure anger issues can be solved with CBT. So CBT spectrum is this broad. It can be used in this kind of thing. So now coming to the therapeutic alliance, therapeutic relationship. What should be there? Like most other therapies, therapeutic relationship is very critical component in CBT, where it needs to be established in order to even start the therapy. Okay. So what are the core thing is, first is impact. Because in any therapy, You have to be empathetic. So if you remember the Rogerian client-centered therapy, that is not a therapy actually. That is the client-centered perspective we learned from Rogerian concept. So those all concepts can be utilized in CBT. That you have to be empathetic, understanding, and you can have a positive regard, warm, genuine, and direct and sensitive. So this, you can be direct, you can hold the mirror in front of your client that yes, this is your thoughts, this is your negative thoughts. Therapy is always not smooth. It also challenges your client. But you can be sensitive, you can be warm and empathetic at the same time. So this building of therapeutic alliance is very important in case of CBT. Now coming to, okay, up to this, I would be asking if there is any question. Otherwise, we'll be moving to the CBT model. We can address if there is any question, any queries, you want to include something. Yes, Vedika.
You mentioned that CBT is time limited, but then in uses, we talked about how it is used for chronic problems. So how does that work actually?
Chronic, sorry?
Chronic problems. You mentioned na, ki it
Chronic
works for
pain.
chronic problems.
It is chronic pain.
Yeah.
It is chronic pain. It is chronic
Let's-
pain, Vedika. If someone is having maybe, arthritis. Okay, so in case of that, maybe many medications have already been used and there is no medical causes for that, or maybe genuine arthritis is there. In those cases also CBT can be used. Of course, in that case also CBT will be structured and session based. It will not be unlimited. That is also, so it's major pain, any kind of pain.
Okay, thanks.
Yes. Um, so RBT, I just, described that RBT is majorly cover all the strategies of CBT only. But the stance of therapy is a bit different. The way you will be forming the therapeutic alliance is different. And I also mentioned in case of RBT, my personal view regarding RBT, that is not my personal view. So this is the postulates of RBT, that RBT is a directive approach and it is direct. So some strategies from RBT you can take, though most of the strategies are same only of CBT, but this kind of directive approach and direct approach is uh, less likely give good outcome in case of our Indian clients as we practice an Indian setup. Because the more you be directive, there will be a problem, because all the family members of your patient is directive, all of their colleagues are directive, all are too direct. Now you should be having a different kind of a stance. So this what is the problem with RBT, I find. So that only I have mentioned while I was mentioning the types of symptom. Okay, so if there is no other question, no, I'll be moving to another topic. I mean, in the sample. Is there any other question? Okay, okay, you can always ask later. No issues. Okay, so now cognition refers to the mental processes. What is cognition? Cognition is mental processes involved in gaining knowledge and comprehension. So what do you mean by cognition? Under cognition, what all things comes? You tell me. Anyone would like to volunteer? In case of cognition, what all things come? Yes, anyone?
Learning, memory, sorry.
Yes, please go ahead. All the mental
Learning,
processes,
memory,
no?
perception.
Learning, memory. Yes. And what else? Actually, basically, our information processing and how our brain, our thinking process and our information processing, even the problem solving, and even the higher order functioning also, higher order cognitions, cognitive activities, all these things. So now CBT is about changing perception. If we see just the one motto of CBT, what is the aim of CBT? It's about changing perception of your client. Now, how? It is the cycle of these three things mainly: thoughts, behavior, emotion. Okay. So thoughts is what we think. Just try to think whatever you are thinking is affecting your feeling. And like if you are thinking now that yes, the class is going good, I think I have done a good job by attending this class, by joining this CBT course, then your behavior will be also like that. Your emotionally also you will feel content, and you'll feel good, and your behavior will also be like, you are taking notes, you are understanding, you are attentively attending this session. And in the case of opposite, you're feeling that why I am even here, I don't understand the things, whatever she's teaching or whatever ma'am is telling, I'm not understanding, I'm not connecting. So you will feel confused, and you will feel very confused, cloud headed, and your behavior will also be, you will be distracted, you will not be very attentive. So just a simple example I give. So it is the interplay between these three things: that thoughts, feeling, and behavior. And always, whatever we think, that affects our feeling and action. That means behavior. Now, however we feel, that affects the way we think and act. That means behave. And whatever we behave, whatever we do, that affects how we think and feel, right? Like if you are now taking notes, and if you're now proceeding things in your mind, then of course you will feel productive, and your thought will also be like, yes, now I have started learning something. So it is very much interrelated. Neurologically, it is like that. So this is only the sample. Now let us see one sample. Okay. Like if we consider this thought, let us first take this first example. Okay. Thoughts: I have let everyone down, they will be angry with me, I'm not a good friend. This is the thought. Absolutely, the negative content you can see in the thought. So what is the feeling? Of course, if someone is thinking that, they will be feeling low or depressed. Nothing else is possible. They will be feeling low and depressed. No, I have let everyone down. They will be angry with me. I'm not a good friend. They will be feeling low and depressed. And what will be the behavior? The behavior can be like withdraw from their friends, avoid friends, or even that can be different. Behavior actually differs due to our personality and other situations, chemistry with other people. Like even it can be, nagging to other. It can be pleasing others. By going to certain extent, it can also be like that. Let's come to this also. This thought: I can't do this. What is wrong with me? Everyone is looking at me. If this kind of feeling is there, of course you can understand a person with generally with the social anxiety will be having this kind of thought. Now what will be the feeling? The feeling will be, of course, anxious, and behavior will be somehow getting away from the situation, and also not just getting away from the situation at present moment, but also avoid this situation to certain extent in the future as well, right? So this is actually sample of CBT model, where in your CBT model you can actually do like this. Okay. So we will be learning until this today. Now I'll be giving you one homework, which we'll be discussing tomorrow. Let us see this. So you have seen this triangle, right? You have seen this triangle. But while you will be doing with your clients or maybe with yourself, at the very first go, doing this will be a bit difficult. So what is the process of doing it? Let us learn, okay? And let us try to do that, and then we'll be discussing tomorrow. So first, what you have to do for this triangle worksheet, that try to think about the situation, any situation in your head, okay? You will be doing it at home, and then we can discuss it tomorrow. Just you have to think of the recent past negative situation. Maybe what made you angry, sad, anxious, or whatever. Now, out of that situation, you can start with your feelings even. How are you feeling? And then, what did you do in that particular situation, and what was the thought? You can start from the feeling and then thought and behavior, or you can start from whichever way. Whichever way you can do, you can do. And after that, try to fall that in that model. Try to fit all the things in this model. Okay. You do not have to mention the situation. You can just make this triangle model of yourself. Any therapy we learned in our during our M.Phil, all the therapies we first applied on us, and it is really useful. If you start applying on yourself, you will be directly seeing the result. The result will be directly shown, and then you will be understanding the real scenario, that what are the difficulties and how you can apply. Okay, so you can just take a screenshot and just you can take a note of this that you have to do, and this also you can take a photo, or even I can just send a photo in the. Akanksha, are you here?
Yes, ma'am.
Okay. So Akanksha, you may take this photo and share in the group this model.
Ma'am, you said that you will be giving the assignment, right? So where will the interns be submitting it on
They
the
don't
Google
have to submit. They don't have to submit anywhere. There will be no Google Classroom. So we will be discussing it here, right here, only in the video call tomorrow.
Okay, okay. And in the future also, we do not need a Google Classroom?
If we need, I'll be telling you. As of now, we don't need.
Ma'am,
All the
because
things will be in the back.
after
Yes.
the meeting, you'll have to share the PPT, right?
Oh, yes, I can share the PPT after this meeting.
Yes.
So in the PPT only you will find this. No issues. So you will be getting this right after the session. I'll be sharing the PPT with you. So previously, I thought that I'll be sharing the PPT in the very last of our training, but it's better this way that I'll be sharing the PPT today, and you can directly go to this page, this slide of 13th and 14th, and you can do this. Okay, and we'll be discussing it here tomorrow. Okay. Someone is asking about the recording. Yes, recording will be provided. I guess. No, of course, recording will be provided.
Yes, ma'am. After the session, we'll be updating a sheet, Google Sheet, and we'll be sharing it on the group itself. There you can access the recordings.
Right. Okay. Okay, fine. Please, everyone, try to do it on yourself. Try to make a model of your, of your own, and then let us come back tomorrow and discuss it and proceed with the further things. Okay.
Hello, ma'am. Pratham.
Yes.
Prathama.
Yes.
Your video is not good actually. Like there are it was stuck for some time, and I couldn't follow your video.
Okay.
Couldn't follow your expression and the way you speak. So it is better you check your network and fix it tomorrow.
Is it same for everyone?
No, ma'am, your
Anyone
video
else?
worked for me. I could hear and see you clearly.
Okay. Other people also
I
said
can
in
also
the.
hear, ma'am, but the video only that's the problem.
Yes, this is Shalini. For me also it was the same. The video was struck in the middle.
Okay. Okay. In that case, I would be requesting. Okay, I'll be trying to do that. Though my network is full only. I don't know why the video got stuck, and why I'm getting the mixed kind of a feedback that video got stuck for some people, and for some people it was okay. Anyways, I'll be checking my network, though it is fine only. And for tomorrow, I will be requesting everyone to kindly switch on your videos, okay, that we can interact in live manner, not like this. Okay, because tomorrow you'll be sharing your own CBT model. So that also we want to do in an interactive basis. And then kindly switch on your videos. Okay. Okay. Thank you all. It was a lovely experience that you all have joined. And let us be hopeful. It's just the beginning. I hope that we'll be having a good 1 month journey. Thank you all.
Ma'am, have you